Welcome to today's COVID-19 update. We are speaking with the Honorable Minister of Health, Dr. Frank Anthony.
All right, Minister, thank you again for joining us. To begin, could we talk about the mobile testing units?
We currently have a mobile testing unit that we use to go into various communities, and we have sent that unit into the Diamond and surrounding communities, and that's because we have seen a spike in cases in Diamond and those surrounding communities. So we thought it's important to get a better picture of what is happening with the epidemic in these communities, and the way to know that is to do more testing in those communities. Hence, we have sent the mobile testing unit. We have also worked out a schedule where on a periodic and ad hoc basis we'll be sending these units into other regions and other communities so as to get a sense of what is going on in these areas. So that would be an ongoing process from now on.
All right. I know we're in the rainy season, so this, of course, would assist in that way, wouldn't it?
Well, when a unit is within the community, it's easier for people who feel they might have been exposed to be able to access the unit. So yes, in that sense, because it's closer to you. And we want to encourage people, if they feel they have been exposed, to come out and get tested. It's a very simple process.
Minister, if we can address quickly the dashboard for yesterday, we did see a reduction. What caused that specifically, if there was any particular reason why? Not in a negative tone, of course, but
yeah, the reason why we recorded low numbers yesterday has nothing to do with, in terms of the amount of testing that we have done. What happened yesterday, they had some difficulty having completed the testing and got the results, that when they start putting it in the electronic format, they had some challenges with the computer. So that has since been rectified, and so we'll get back the results as per normal from today. So it was one of these computer things that, a computer glitch that we had.
Okay. And quickly, any information out of Region 1, anything that changed from the last time we spoke?
Yes, we've seen a slight change. In Guyana we had 62 active cases. We have now been able to discharge 10 persons, so as of today, our current active cases are 52, which is a good indication. And although we have been testing more people in Region 1 and in Guyana specifically, we have not recorded any additional cases in Guyana.
All right. Minister, I have a few questions for you that came from the other media houses. NCN is asking, in terms of the other health campaigns like malaria, diabetes, and HIV, the focus is on COVID-19, but do we have enough resources to maintain these other campaigns?
Oh yes, we do have resources for everything that the ministry is doing. Remember, from the budget, this ministry received one of the largest budgets. We have about 52 billion Guyana dollars to do our work. So despite the challenges of COVID, we did not compromise in any area to offset the work that we are doing in COVID. In fact, we have gotten more resources so that all these other critical areas can be adequately taken care of. Our work in malaria continue. Our work in chronic disease continue. We have had some challenges because of the start of the pandemic. I think the Ministry of Health would have curtailed its outreach activities, curtailed the amount of things that they're doing at the clinics and so forth. So we are now reopening a lot of those services. And, very shortly we'll be more or less back to normal in a sense of the health services that we are providing. We have also, for malaria, we have gone out and purchased a lot of the insecticide impregnated bed nets, which is an essential prevention tool, because if people use them, then the mosquito would not be able to bite them, right? And in fact, when mosquito comes close to these nets and they light in the nets, then they come in contact with the insecticide, so they kill the mosquito. So we have purchased more than 100,000 such bed nets, and we'll be starting a program of distribution to those regions where we have high infestation of mosquitoes to prevent malaria and other mosquito-borne diseases. So in a short while, we'll roll out that distribution. We're working with the Ministry of Local Government, and together we'll be able to get these bed nets out to the communities that need them.
Of course. And if my memory serves me right, the medication for HIV, you were able to get that in the last set that you...
Yes. As you know, we had a shortage because of the difficulties in ordering and whatever else happened before in the ministry. But at least in the interim basis, we have been able to fix that problem, because we were able to access ARVs from Suriname. We have also been able to access some from Brazil. So together, at least we have ARVs to treat our patients right now. This would give us a period by which we should be able to get those that we have on order. And once we get in those that we've ordered, we will then be able to replace those that we've borrowed from Suriname and Brazil and have enough for our patients. So yes, we are doing that. We have also had some challenges with HIV kits, meaning to test people, and we have brought in adequate supplies, so we've been able to restore that service as well. We've had some challenges with not having reagents to test babies when if their mother are HIV positive. Normally we'll take a sample and test it in the lab to just make sure that these babies are not infected with HIV. For more than a year, we weren't able to do those testing. We have now brought in all the reagents, we have now started testing, and we have cleared whatever backlog there was. So that if there were any child that tested positive, now we were able to identify those children and provide the relevant treatment for them. So we have done a lot of work in some of these areas, and the idea is to stabilize the procurement of test kits and reagents and also the medicines that people would need, and to restore services, because in this pandemic what is important is that we provide services for those persons who are at risk. So your diabetics, hypertensive, people with cardiovascular diseases and so forth, they all need to be getting their meds and be controlled. And at least if we have them have their disease condition under control, then it would minimize their risk for COVID-19. But again, we have to keep working at this to make sure that all those persons at risk are actually getting their medication.
Okay, Minister, thank you. The Guyana Chronicle is asking you for an update on the activation of regional COVID-19 ICUs.
Yes, we have started that process, and we have been sending out the ventilators to these regional hospitals. So, for example, Region 6 have received their ventilators. They have I think they have installed it and they have tested it. They didn't have any patients as yet, but it's installed and it's ready to go. Similarly, in Region 2, they have done the same thing. I think Region 1 would have to uplift theirs. Some of the outlying areas, the regional hospital, we have told them to come in and get theirs. So they'll take it up, and again, we'll give them guidance on installation. Region 10, I know they are buying 2 of their own, but we have, if they need it, we have. But apparently they had in their regional budget to be able to purchase 2 ventilators. But we'll be checking with them shortly, and if they really need one right now, we will be able to give it to them. So I think all the RHOs in the different regions, they are now, based on our vision of building the capacity in the regions, they now know that they can access these facilities from us and start putting it in their hospital. In addition to ventilators, we also have oxygen concentrators, and those are available to them as well. So little by little, we are trying to improve the capacity that we have in the region.
Okay, Minister, thank you so much for talking to us today.
Well, thank you.
That's it for today's COVID-19 update. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.